COVID cases continue to drop here in Indiana, and that means relief for doctors and nurses. Now we are getting an inside look at how COVID hospital wings are operating right now. On floor B7 at IU Health's Methodist Hospital, it is busy, but it is nothing compared to 2 years ago. At one point, all 24 beds on one floor were occupied by COVID patients. Yellow carts lined the hallways full of PPE. But as of yesterday, there were no COVID patients on that floor, and the hope is it will get easier to manage.
Could it be something that we're going to have to live with? Yes, that's very possible. And so I also hope in that regard that if it's something we're going to live with, that we're much more equipped to deal with.
And for now, Dr. Gavin and his team are taking it one day at a time. Moderna says its COVID vaccine works just as well in young children as it does in adults. But despite the promising data emerging as the FDA considers emergency usage, a large number of parents still aren't getting their kids the shot. According to the Indiana Department of Health, only 20% of children 5 and up have the COVID vaccine. Nationally, numbers are a little higher, with 1 in 3 kids fully immunized. Dr. John Christensen with Riley Children's Health says that's concerning.
I think it has got a little easier to talk to people about flu, for example, but because there's a lot of flu activity in the community. But once you bring up coronavirus, they have no interest because everybody tells them that coronavirus is more or less gone.
And Dr. Christensen says he wants parents to know these vaccines are safe and effective for adults and kids. And if you have any questions, he says, don't turn to social media. Use your doctors instead.